Well, China is to include asymptomatic COVID-19 infections in its daily case count from tomorrow. The decision comes after growing concern about the accuracy of China's data. Around the world, if a patient tests positive for COVID-19, they're counted as a confirmed case. But up until now, that's not how China has been recording its infections. Asymptomatic carriers have been excluded, in fact, from the national tally. And that is against World Health Organization's guidelines. The WHO defines a confirmed case as a person with laboratory confirmation of COVID-19, irrespective of clinical signs and symptoms. China has changed its criteria for counting new infections on several occasions, and that's raised questions about the true scale that we're seeing of this outbreak. The National Health Commission has revealed 1,541 patients who don't have symptoms have been put under observation. Citing classified data, the South China Morning Post says that China has found more than 43,000 cases of asymptomatic infection through contact tracing. Now, a leading Chinese expert who treated critically ill patients in Wuhan, that was the epicenter of this outbreak, says that they could potentially infect others.
无症状感染者他本身有传染性，所以呢，我们一定要发现他就主要是通过检测尤其是有疫情接触史或者病人接触史这样的一种人，我们一定要让他们主动的报告。 然后呢，给他们做病原的检测，发现了及时的隔离和治疗，不至于再造成其他人的传播。
Our correspondent Olivia Xiong joins us now for more. Olivia, why has China decided to release its asymptomatic data now?
Well, in recent days, we've seen growing public concern over these asymptomatic cases. And on Chinese social media site Weibo, netizens are saying that the inclusion of asymptomatic cases in daily reporting should have been done earlier on as well. And there is especially concern, as we've seen in recent days and the recent weeks, a relaxation in some of the restrictions across China. And as more people from around the country are starting to travel within China as well, and as the country tries to get production resumed and more people back to work. So there is concern of the infection spreading with these so-called silent carriers. And in recent days, we have seen more reports of such asymptomatic cases popping up in various parts of China. On Sunday, we heard about in Henan province, a confirmed case who had caught the virus from an asymptomatic individual, and that had caused public concern. What Chinese officials are saying is that yes, asymptomatic individuals are infectious, but just how infectious they are or how long they remain infectious for, more research needs to be done to look into this. But nonetheless, yesterday we heard Chinese Premier Li Keqiang say that more needs to be done to manage asymptomatic cases. He said that information about these cases should be released in an open and timely manner without any delay or underreporting. He also warned against any form of cover-up to maintain the zero new cases count in any part of China. And he said that truthful information will allow the public to protect themselves and to take necessary precautions. Now, the big question, though, is that now China has said that over 1,500 asymptomatic individuals remain under medical observation. But as of now, we do not exactly know the full number of asymptomatic cases in China. And according to the South China Morning Post report that you had cited earlier, they are saying that this could be adding up to about more than 43,000 people. And so it remains to be seen whether or not authorities will be backdating the data and releasing the total number of asymptomatic cases that have been detected in China.
With that being said, Olivia, then how are authorities going to manage asymptomatic cases going forward then?
Well, I think one of the things that the Chinese officials have been keen to emphasize is that there have been guidelines to manage asymptomatic cases since late January when this epidemic, basically started. And they say that this requires medical facilities to report once they have discovered or detected an asymptomatic case, and they also have to investigate this incident. And patients that are asymptomatic also have to be isolated. Have a listen.
无症状感染者要集中隔离14天，原则上集中隔离满14天，要求经2次连续间隔24小时。 核酸检测阴性，可以排除解除隔离。如果核酸检测仍为阳性，要继续集中隔离医学观察。无症状感染者的密切接触者也要进行14天的隔离医学观察。
So basically, building on that, moving forward, authorities say that they will be stepping up screening and testing and broadening the scope in which they test individuals for COVID-19, especially among the close contacts of confirmed cases as well as asymptomatic cases, as well as in key regions and populations as well. Now, all entering the country also have to be tested, and once an asymptomatic case is confirmed, it will also be investigated, and the information will have to be made public. But authorities, health officials are saying that there are challenges, just given the fact that some cases that are asymptomatic continue to remain asymptomatic, and that makes it difficult to detect. And so what they're saying is that detection and isolation cannot be the main measure or strategy that is being adopted. But what they will continue to do is to manage the close contacts of confirmed cases, as it has said that its past experience has shown that by managing the close contacts and introducing measures to reduce interactions between people can help to bring the epidemic and the spread of the virus under control.
Okay, many thanks for that. Olivia Xiong speaking to us, and do apologize for the breakup in the audio there.